I'm letting reporters in. Okay, good afternoon, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19 and also on Monday's officer-involved shooting and resulting civil unrest. As noted in the advisory that we issued earlier, from 1 until 1:30, Health Commissioner Dr. Thomas Farley will provide updates on COVID-19, and then both he, the mayor, the managing director, will take questions on COVID-19 only, as well as related matters, including the encampment on the Parkway. And joining us as well on that is Deputy Managing Director Eva Gladstein. So again, this first part is only on COVID-19 and related topics. At 1:30 or thereabouts, we will segue to questions on the officer-involved shooting. At that point, the mayor and managing director will be joined by Police Commissioner Danielle Outlaw and Acting Commerce Director Sylvie Gaillard-Howard. If your hand is raised and your question is not on COVID-19 or related topics, please lower it now, and we'll announce when we get to the second portion at around 1:30. Because of the very limited time on COVID, only one representative from each media outlet is permitted. And today we are asking reporters to limit their questions to 2. We're going to start off though with an update from Dr. Farley.
Thanks very much, and thank you all for joining. We are seeing rapidly rising case counts of the coronavirus infection here in Philadelphia, and what appears to be the beginning of a fall-winter surge of the epidemic. Here are some numbers. Since this time yesterday, we have identified 340 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 42,924 confirmed cases since the beginning of the epidemic. Now, in addition to that, we have 22 new probable cases diagnosed by the rapid antigen test. Over the past week that ended on October 24th, we averaged 296 cases of this infection per day in Philadelphia residents. That's our highest weekly case count since the first week of May. Now, our data is incomplete, and that number will even increase beyond that. Now, for the previous week that ended on October 17th, we averaged 205 cases per day. And that's the case count, but the percent of people who are tested that are testing positive is also increasing. For the last week that ended October 24th, we're averaging 7.2% of people tested being positive so far. We expect that number will rise as some of the laboratories report only positive test results report to us later. That's higher than the 5.1% positive the week before and 5.1% positive the week before that. That 7.2% positive is the highest percent positive that we have seen since the first week of June in this epidemic. To put it in perspective, at the low point of the epidemic in mid-September, 2.8% of people tested were tested positive. But in the peak of this epidemic on April 5th, 39% of Philadelphia residents who tested were positive. The increases we're seeing in case counts are occurring in every age group, from children through people in their 70s. They're increasing in every racial and ethnic group, and they're increasing in every zip code in the city. That's what's happening in Philadelphia. The larger context is that we're seeing very rapid increases elsewhere as well. There are all-time highs in daily case counts for Pennsylvania as a whole and for the United States as a whole. Now, back here in Philadelphia, just a word or two on schools. We're continuing to see isolated cases in students and in staff. And some schools have had more than one case. Some schools have had quarantines. Some schools have temporarily quarantined and gone to all remote learning. But besides the one school situation that we talked about a week ago, we've had no additional school cluster where it's clear or appears to be clear that this spread occurred within the classroom. Now on schools, it's worth noting that the Pennsylvania Department of Education has thresholds for the amount of community cases for which they recommend that schools go to remotely learning only, to all online. Those thresholds are more than 100 cases per 100,000 population over a 7-day period, or a percent positivity of more than 10%. Now, as of last week, Philadelphia just barely reached above the first threshold of 100 per 100,000 population. But as you saw with the 7.1%, we're still below the 10% threshold. Now, in the wake of that, a number of schools have contacted us to ask if they are required to go to remote learning only. At this point, here in Philadelphia, we are not recommending that schools that are currently offering in-person learning to stop to do that. We're not requiring them to do that. Now, some schools may choose to do that on their own, but we're not requiring that at the moment. We will watch the data, and we may change that recommendation if case counts and the percent positive continue to rise. Now, with the rising number of cases, we're also seeing an increasing number of people who are going to hospitals. And so with that, we need to watch our hospital capacity. We want to make sure our hospitals don't get overwhelmed. The state has a database that's on their public website that says how many patients are currently hospitalized with COVID in each county in the state, and has for Philadelphia 211 patients currently hospitalized, again, with COVID. Now that number is increasing. It hit a low point of about 90 in late September. But to put it in perspective for comparison, the hospitals in Philadelphia peaked in the spring epidemic wave at a little more than 1,000 COVID patients in all hospitals combined on April 24th. So with 211 in the hospitals right now, we do have many more that they can handle. They can handle more. However, we still need to watch this closely over the next few months. What's happening with deaths? Since this time yesterday, we've identified 5 new deaths from the coronavirus infection, bringing us to a total of 1,864 since the beginning of the epidemic. Now, for the past few weeks, we've been averaging about 10 deaths per week, and we're not seeing an increase tied to this epidemic wave yet. It's worth me backing up a little bit on that. One positive change we've seen since the beginning of the epidemic is that we're seeing fewer deaths for every case identified than we did early on in the spring. So in the spring, there was about 1 death for every 15 cases that were identified. But in August and September, there's been about 1 death for every 60 cases identified. You might ask why that's the case. Well, first, we are identifying more cases of infection in people who have no symptoms or have mild symptoms as we're doing more testing. These are people who would not have been diagnosed in the wave in the spring because testing wasn't that much available. Second, the people who are infected tend to be younger than people who were infected in the spring wave. Third, even among people who go to the hospital with a severe infection, their mortality rate appears to be going down. So we think that the treatment of this infection in hospitals is improving as the hospitals have gotten more familiar with how to treat this infection and as their medications and tools have gotten better. And fourth, there's been a suggestion, not proven, that when people wear masks and when they keep a distance from people, that even if they do become infected, that they're getting a lower dose of the virus than they would if they weren't wearing a mask. And so even if they have the infection, that infection is less severe. Can't say that that's true, but it certainly may be true. And that's yet another reason for everybody to be wearing masks right now. Now, this lower case fatality rate, though, is not a reason to abandon our safety precautions. This disease absolutely still can be deadly. Even if a small fraction of the people with this infection die from it, if we have hundreds or thousands of people infected per day, that still leads to many different deaths. We're seeing an increase in deaths from COVID in Pennsylvania and the United States as a whole with this new wave. And we expect to see an increase in deaths here in Philadelphia in the next 1 to 2 weeks, just based on the rising case counts that we're seeing. But we will pay closer attention now to hospitalizations and deaths and not just cases when making our policy decisions. So that's where we are with the epidemic. What do we know about where and how the virus is spreading in the city right now? Well, here's what we're learning from our case interviews that are done as part of contact tracing. We know the virus is spreading within households, it's spreading among relatives and among friends, and it's spreading at social gatherings. This is, for example, when relatives are visiting each other to help take care of children, or they're visiting to take care of a person who has a fever, or sleepovers amongst teenagers, or the pizza party after soccer practice, or carpools, or friends getting together to watch football games on television, or weddings and bridal showers. Now, these social gatherings, particularly celebration gatherings, are very dangerous because people get very close and because they tend not to wear masks because they want to look good for the pictures. Now, in addition to that, there's some suggestion now that some spread might be occurring in restaurants. Here's what we have on that, is that we went carefully through the interviews we did for our cases as part of contact tracing. We looked for the percent of those case interviews where words were included in the narrative suggesting restaurant dining. That percentage increased from 11% before we allowed indoor dining to 16% afterwards. We can't be certain, but certainly there's a possibility that some of the spread then is occurring in restaurants. The overall message, though, is that the virus is spreading now rapidly in households, family gatherings, and social gatherings, maybe in workplaces, and maybe in restaurants. The risk is increasing now with the colder weather and the drier air, and more people being indoors. And it appears that then this virus, COVID, is following the same pattern of other respiratory viruses like influenza that rise throughout the fall and peak typically in January or February. With that in mind, we anticipate further rapid increases of this infection in Philadelphia, which means we're entering a difficult, dangerous period of this epidemic, possibly the worst period of the entire epidemic. Now, we hope to have a vaccine soon, but much of this surge will happen before the vaccine arrives, which means we need to step up our safety precautions now and hang on to it just a little bit longer until the vaccine does arrive and we can protect people from this infection. So with that in mind, what we are going to do at the city is first to continue to expand access to testing so that people can identify quickly if they have this infection, so they make sure that they isolate themselves from others to try to prevent spread to others. Second, we're going to shift our contact tracing work from which we're trying to do all case management of all individuals to sometimes simply giving guidelines to others about how they can do their own contact tracing. We simply don't have the manpower to do individual case management for every case that's being reported today, given the very large numbers. Then we're going to do everything we can to protect people who are particularly vulnerable to this infection, vulnerable populations. That it means especially people in nursing homes, it means people in other congregate living facilities, and it means vulnerable people who may be living at home and getting home health services. Then if we identify specific settings where we have evidence of substantial spread, we may restrict or prohibit those activities. Now, we have some restrictions that are in place that we never released before, and we're not imposing any new restrictions today, but we are considering a range of options. Now, just a couple of words on what businesses should be doing with this epidemic wave. First, let me just say, I understand this is a very difficult time for businesses. It's been months when their income has taken a big hit. And we want businesses to bring in more revenue also. We want more people to have jobs. That's good for our health. It's good for our city. But the businesses must understand that the business success is tied to the city's success in combating the epidemic. If the epidemic continues to get worse, that's worse for everyone. So we're asking for your help now as businesses in reinforcing the safety rules, especially the rules around masks and distancing. People come in contact with all sorts of businesses, from retail store to many other types, and we know that not all the time are people wearing masks. You're in a position to reinforce those safety rules. If you do that, that'll help us all get past this epidemic, to survive in our health and also to get businesses back on their feet. And what should Philadelphia residents do right now? Well, because the spread is happening mostly in private settings, our success depends mostly on what Philadelphia residents do on their own. So first of all, work from home if at all possible. Don't go to the workplace based on evidence we have that this may be spreading in workplaces. Second, stay away from others unless it really is necessary. Don't have a get-together after soccer practice. Don't join your friends to watch football games on TV. Stay at home as much as you can. Then I have to say this, and I know this is difficult. We're recommending that people cancel their planned family holiday gatherings. We're not going to get past this epidemic by Thanksgiving or by Hanukkah or by Christmas. Family gatherings right now are simply very dangerous. Now, in normal times, nothing better have a big family gathering, but not this year, because these are not normal times. And finally, again, wear a mask when you're around anyone who's not your household member. First, you should assume that anyone you come in contact with has the infection. If they aren't wearing a mask, ask them to. And then assume that you have the infection and don't know it, and you should wear a mask, so you should protect others. Thanks very much. More information is on our website, www.phila.gov/COVID.
Thank you, Dr. Farley. Now we'll go to Armando for the Spanish language translation.
Actualización en materia de salud para el 27 de octubre del 2020. El recuento de casos en nuestra área está aumentando rápidamente. Este es el inicio de la oleada de otoño y de invierno. Hoy reportamos 340 nuevos casos confirmados con pruebas PCR en Filadelfia, con un total de 42.924 casos al día de hoy. Hoy se reportan 22 casos probables según la prueba rápida de antígenos. En contraste con estos 340 casos, la semana del 18 de octubre al 24 de octubre, en promedio, tuvimos 296 casos diarios. Esta ha sido la semana más alta con un promedio de casos positivos desde la primera semana de mayo. No contamos con todos los datos completos, así que podremos esperar un aumento en estas cifras. Asimismo, el porcentaje de casos positivos está incrementándose también. Del 18 al 24 de octubre, el porcentaje de positividad fue de 7,2%, en contraste con el 5,1% de casos positivos que se registró la semana anterior, del 11 al 17 de octubre. Este es el mayor porcentaje de casos positivos registrados desde la primera semana de junio. Para ponerlo todo en perspectiva, el punto más bajo fue a mediados de septiembre con un 2,8% de casos positivos, y la semana más alta fue la del 5 de abril con un 39% de casos positivos. Los aumentos de casos los vemos en todos los grupos de edad, desde niños hasta los mayores de 70 años. Asimismo, vemos un aumento entre todas las razas y grupos étnicos, y vemos también aumentos en todos los códigos postales de la ciudad. En todos lados, en los Estados Unidos y en Pensilvania, los casos van aumentando diariamente. Con respecto a las escuelas, hay muchas escuelas que han registrado casos en sus estudiantes hasta el momento. Algunas escuelas han tenido más de un caso. Varias escuelas han tenido cuarentenas. Y además del brote en una escuela, no hay información adicional que indique claramente la propagación en las aulas. El Departamento de Educación de Pensilvania tiene márgenes en el caso de brotes por propagación comunitaria para recomendar el aprendizaje remoto únicamente cuando haya más de 100 casos por 100.000 habitantes por 7 días con un más del 10% de positividad. Filadelfia está apenas por encima de los 100 casos por 100.000 habitantes, pero por debajo del 10% de positividad. No recomiendo que las escuelas que actualmente ofrecen aprendizaje en persona se detengan. Algunas personas pueden optar por cambiar la modalidad en sus escuelas por su cuenta. Nosotros seguiremos observando la recomendación que puede cambiar si el recuento de los casos y el porcentaje positivo continúan aumentando. Con relación a los hospitales, con el aumento del número de casos, es necesario vigilar la capacidad de los hospitales. De acuerdo a la base de datos estatal sobre los hospitales, 211 pacientes actualmente están hospitalizados con el COVID en Filadelfia. Este número va en aumento. El mínimo de pacientes fue de 90 a finales de septiembre. A modo de comparación, los hospitales de Filadelfia tenían más de 1,000 personas hospitalizadas el 24 de abril, por lo que sabemos que pueden manejar muchos más. Pero tendremos que observar los próximos meses cuidadosamente. Con respecto a las muertes, reportamos 5 nuevos fallecimientos con un total de 1,864 fallecidos. El promedio es de 10 muertes por semana. Todavía no hemos visto un incremento en las cifras de muertes por el momento. Pero hay un cambio positivo. Hay menos muertes por cada caso que identificamos en la primavera. En la primavera teníamos una muerte en promedio por cada 15 casos identificados. En agosto y septiembre habíamos reportado una muerte por cada 60 casos identificados. ¿Por qué ha pasado esto? Hemos identificado más casos de infección en personas sin síntomas o con síntomas leves. Las personas infectadas son ahora más jóvenes y el tratamiento en los hospitales también ha mejorado. Tal vez debido al uso de las mascarillas y el distanciamiento social. Las personas infectadas tienen una dosis más baja del virus, por lo tanto presentan una infección menos grave. Sin embargo, esto no es motivo para abandonar las precauciones de seguridad. La enfermedad aún puede ser mortal. Incluso si es una pequeña fracción de la infección la que es fatal, si cientos o miles de personas se infectan por día, eso todavía resulta en demasiadas muertes. Vemos un aumento en las muertes por el COVID en Pensilvania y en los Estados Unidos en esta nueva ola. Y esperamos ver un aumento de muertes en Filadelfia en las próximas 2 semanas. Pero prestaremos más atención a las hospitalizaciones y a las muertes, no solamente a los casos al momento de tomar decisiones. ¿Dónde y cómo han ocurrido los brotes? Hemos aprendido de las entrevistas de casos, como parte del rastreo de contactos, que los brotes han ocurrido dentro de los hogares, entre familiares y amigos y en reuniones sociales, entre los familiares que se visitan para ayudar a cuidar a los niños o una persona enferma, en las pijamadas o fiestas de adolescentes, en las celebraciones como pizza parties después de la práctica de los deportes, en los transportes compartidos, entre amigos que se reúnen y ven partidos de los Eagles en la televisión, en las bodas y en las despedidas de solteros. Esto es muy peligroso porque siempre que las personas se sientan juntas hay más contacto y no usan las mascarillas. Podría estar ocurriendo también esta propagación en los restaurantes. Revisando las notas de las entrevistas, vemos que el porcentaje que sugería el contagio por comer en un restaurante aumentó del 11% antes que se permitiera el servicio en el interior de los establecimientos al 16% que tenemos ahora. El mensaje en general es el siguiente. El virus se propaga en hogares, reuniones familiares, reuniones sociales, tal vez en los lugares de trabajo, tal vez en los restaurantes. El riesgo aumenta ahora con un clima más frío, el aire seco y más personas reunidas en los interiores. Parece seguir el patrón de otros virus respiratorios como la influenza o la gripe. Esperamos un aumento durante el otoño y un pico nuevamente entre enero y febrero. Anticipamos nuevos aumentos de los casos rápidamente. Así que estamos entrando en un periodo difícil y peligroso, probablemente el peor periodo de toda la epidemia. Esperamos tener una vacuna pronto, pero gran parte de este aumento ocurrirá antes de que nos llegue la vacuna. Así que tenemos que intensificar las precauciones de seguridad solo un poco más. ¿Qué vamos a hacer nosotros al respecto? Continuaremos ampliando el acceso a las pruebas, cambiaremos la modalidad de rastreo de contactos para dar pautas y recomendaciones a las personas infectadas y protegeremos a las poblaciones vulnerables que están en residencias de ancianos y en otras instalaciones o entornos congregados. A las personas vulnerables, a aquellas que tienen condiciones preexistentes que viven en casa. Si nosotros identificamos entornos específicos donde se esté produciendo una propagación sustancial, podremos emitir nuevas prohibiciones o restringir actividades, pero no impondremos nuevas restricciones hoy. Estamos considerando una variedad de opciones que aún tenemos disponibles. Hay un mensaje para los negocios y los dueños de negocios en la ciudad. Entendemos que esta es una situación muy difícil, que los meses en los cuales estuvieron cerrados se afectaron los ingresos seriamente. Queremos que las empresas generen más ingresos también nosotros, pero las empresas deben comprender que el éxito empresarial está ligado al éxito de la ciudad en su lucha contra esta pandemia. Así que, por favor, solicite ayuda para reforzar las medidas de seguridad, el uso de las mascarillas y la distancia social. Ayúdenos ustedes a superar esto juntos. ¿Qué deben hacer las personas? Debido a que la propagación ocurre principalmente en entornos privados, el éxito depende principalmente de lo que hagan las personas en la ciudad. Las personas deben trabajar desde casa si es posible. Deben mantenerse alejados de los demás a menos que sea necesario reunirse. Las personas deben cancelar reuniones grupales o vacaciones familiares que ya hayan planificado. Esto no se resolverá para el Día de Acción de Gracias, Hanukkah o para la Navidad. Nada mejor que una gran reunión familiar para celebrar las fiestas, pero no este año. Por favor, utilice su mascarilla cuando esté cerca de alguien que no sea un miembro de su hogar. Suponga que todos tienen el COVID-19. Si los demás no usan mascarillas, usted pídales que lo hagan. Además, suponga que es usted quien lleva la infección. Así que use su mascarilla para proteger a los demás, porque solo juntos podemos superar y enfrentar esta pandemia. Muchas gracias.
Okay, thank you, Armando. We're now, for those who joined late, and we had a number of reporters entering late, a reminder that we are still in the COVID portion of the press conference. We will move in a short while to the matter of the police shooting. But for now, let's take some questions for Dr. Farley and others. First, A reminder that we are limiting, because of limited time, limiting reporters to 1 or 2 questions at a time. And we'll start with David Melandra of Philly Sports Network. David, you're up.
My question's for you, Dr. Farley. With the amount of cases rising in the state, do you have concerns about high school sports still being played? And also, the NCAA just came out saying that the college basketball season will start on November 25th. What are your concerns about that?
I have concerns about a wide range of activities that are occurring now where the virus may be spreading, including sports activities. We have worked with colleges here around protocols for basketball, but with the cases rising, we have to be concerned about what makes sense to do when we get around to basketball season.
David?
I'm good. I'm good.
Okay, very good. Let's go now to Laura McChrystal of the Inquirer.
Hi, a quick question for Dr. Farley. You mentioned that you're considering additional restrictions. So I'm just looking for clarification. Is that something, can we expect additional restrictions in the coming days, or are you still undecided on that?
We're undecided around it. We're considering it now. We haven't made any decisions.
Okay, that's all from me. Thank you.
Thank you, Laura. And now let's go to Martin Pratt of Philly YBN.
Two questions. One for Eva. Going back to the eviction mediation court situation, 2 of our viewers asked us to ask this question. Specifically, if you received an eviction notice, the eviction proceeding is happening, what's the process for a tenant to do to get their landlord? This is eviction that's already in process. It hasn't seen a court date yet, but do they have to talk to their landlord and get the landlord to come to the court and the landlord has to fill out the information, or do they just fill out paperwork? And where can they go to ask these type of questions on the city website?
So my suggestion would be that they go either to phillytenant.org website, and that phone number, there's a tenant hotline, is 267-443-2500, and they can help them sort out their various options. Some of them may be eligible to fill out a declaration with the federal CDC moratorium. Others may not be. They can help connect them with additional legal services.
Real quick, that CDC moratorium, it does affect Philadelphia. Is it just for Pennsylvania, or it affects the city of Philadelphia?
It's CDC, it's national, but it's only in certain circumstances, and the tenant has to complete a declaration, and the cause of eviction has to be non-payment of rent. So there are certain, it's not 100% applicable to every situation.
Excellent. I'll be emailing you for the numbers we had to get last week. Dr. Farley, real quick, you said that you saw possibly some correlation to rising numbers in restaurants. I was wondering, of that number, did you see any rise in staff that were actually staff members of the restaurants?
We do ask occupation, and we haven't seen any clear increase in the number or percent of cases that report that they work in restaurants.
And is that across also other frontline workers, a grocery store, hospital workers?
Correct.
No increase there.
Right. Now, the numbers are fairly small for each of those categories. And so, small changes may not be noticed, but we're not seeing any clear increases in those occupation groups.
Okay, that's it. Thanks, Mike.
You got it. Thanks, Martin. Let's move quickly to Claudia Lauer of the Associated Press.
Hey, how are you? I just have 2 quick questions, and I apologize if I missed these. Dr. Farley, I was looking for any numbers you have on the increase in hospitalizations. And then you had mentioned possibly teaching people to do self-contact tracing. I was wondering if you could elaborate just a little bit on that.
Yeah, so we have 211 people with COVID hospitalized in Philadelphia hospitals as of this morning, reported on the state's database. And for comparison, at the peak of the spring, we had over 1,000 people with infection in hospitals. I didn't say self-contact tracing. I did say that we're going to be trying to shift from individually case managing every case and every contact to some guidance. So our staff will be talking to people when they do the case investigations, and they may tell people, okay, you need to notify these contacts because we don't have time to do it. We may notify those contacts.
Got it. Thank you.
Okay, let's go to Nina Feldman of WHYY.
Hi, Dr. Farley, you mentioned expanding testing. Can you talk a little bit more about what that's going to look like, where, and by how much?
Yeah, we've been working to expand testing really since the beginning. We're now up, I've lost track, but it's over 60 different testing sites. There will be probably a small number of additional testing sites that will come online with we've been funding organizations to set up additional testing sites. We also will be making rapid testing more available. So some of these sites will have the ability to give people an answer in a matter of minutes rather than 24 hours later. And I should say overall, we are, as of last week, we did about 4,100 tests per day. We've long had a goal of getting up to 5,000 tests per day. So we were at 2,500 just a few weeks ago.
Got it. And then one other detailed question on the contact tracing issue. I understand the numbers wise that you wouldn't be able to get to all of the contacts of each individual case. Is it still the goal to reach every case for the contact tracers by the city?
With the numbers we're having now, we're not going to be able to reach every case either.
Okay, thank you.
Thank you, Nina. And this is last call right now for Dr. Farley and any questions on COVID. David Melangelo, let's go back to you real quick.
Dr. Farley, have you heard any updates about how the Eagles have done so far about them allowing the fans in through the first 2 home games so far? Any result of any cases spiking from that?
And we don't have any clear evidence of spread amongst people in the stadium. We have heard about people with infection in the stadium, and we have some concerns about that, but no clear evidence of spread in the stadium right now.
All right, thank you.
Thank you, David. And Victor Fiorella of Philadelphia.
Thanks, Dr. Farley. A quick question. Wells Fargo Center announced that they're going to be hosting indoor movies starting this Wednesday, and they plan on doing it throughout the rest of the year, doing themed movie weeks. Do you think this is a good idea to have a bunch of people indoors watching movies at the Wells Fargo Center in light of the rising numbers that we're seeing?
Well, that's in keeping with the guidelines that we and the restrictions that we have in place right now. We said that they can have indoor gatherings. There needs to be a lot of space between people, and they need to enforce mask use, et cetera. But as I said, with the rising case rates, we're looking at a variety of restrictions. And so it is possible that we will be restricting that in the future. I would certainly say if they're going to do it between now and any change in policies we announce, I want to make sure that they're very careful to have the people be a long way away from each other, and everybody's got to wear a mask.
Thank you very much.
All right, thank you, Victor. We're going to shift now to our second topic, the police-involved shooting and resulting civil unrest. I wanted to remind all of the members of the media who have been logged in that you need to ensure that your Zoom login name includes your full name and media affiliation. And you can do that by mousing over the word more in the participants list and selecting rename. Anyone without listing their full name and affiliation will not be called upon. And with that, let's turn things over for some comments from Mayor Jim Kenney. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. As I said in my statement I issued last night, my prayers are with the family and friends of Walter Wallace Jr. I had the opportunity to speak briefly last evening with his wife, mother, and father, and obviously this was a heart-wrenching moment for everyone. I have children that age, and I cannot imagine their heartbreak. I promised them to continue to reach out and to hear their concerns firsthand and to answer their questions to the extent that I am able. Like many of us, I have watched the video of this tragic incident, and it presents difficult questions that must be answered. The officer-involved shooting investigation unit of the Philadelphia Police Department will conduct a full investigation. I have confidence in their ability to carry this out. We need a speedy and transparent resolution for the sake of Mr. Wallace, his family, the officers, and for all of Philadelphia. Last night, we saw further evidence of the anguish of Black and brown residents of our city who have struggled their entire lives under systemic racism. I've said many times, I've lived my life as a white man, enjoying all the privileges that brings. So I cannot truly fathom the reality so many fellow Philadelphians of color have endured, and how a tragic incident last night can feel yet again like our systems fail to protect Black men. But my commitment to understanding that anguish and to accomplishing truly lasting reforms is unwavering. I am resolved to devote every remaining day in this office to bringing about justice and true equity to the city. That's why we established the Pathways to Reform and Reconciliation Steering Committee a few months ago to enact meaningful change. I'll be meeting with members of this group this week, specifically about last night's tragedy, so they can continue to help us move forward and advance our reform agenda. We'll also continue to coordinate with our Office of Public Engagement, particularly its Office of Black Male Engagement and the Office of Diversity, Equity, and Inclusion to keep the community informed. I thank all the Philadelphia leaders who have joined us in a shared call for peace in our city. And I extend my best wishes to the officers who were injured last night, especially the police officer who was hurt after being hit by a vehicle. I wish them all a speedy recovery. Finally, I want to acknowledge the other community members, including business owners along 52nd Street and in the surrounding areas that are now suffering once again due to some of the damage caused last night. I know that many Philadelphians are feeling frustrated and outraged following yesterday's tragic incident. I fully support your First Amendment rights to protest, but we also want to ensure that our communities are not further hurt as a result. Please be careful. Now I turn this over to Police Commissioner Outlaw.
Commissioner, do we have you there? We're not hearing you. Commissioner? Commissioner, you'll need to unmute and activate your camera if you could. At the very least, unmute. Commissioner, we cannot hear you. I don't know if you can hear us. All right, we're going to ask everyone to hang tight, and we're going to try to see if we can. I know the commissioner is logged in, so let us see if we can get it working on her end. Again, our apologies. We are attempting to work out some technical issues with the police commissioner. Let's try this one more time. Commissioner Outlaw.
Can you hear me?
You bet.
All right.
And we don't see you. I know the television folks who are logged in would prefer to have video. There we go. All right. We appreciate it.
I apologize for that.
Yeah, no problem at all. Things happen, and obviously things are quite hectic. We just heard from Mayor Jim Kenney. we know that you wanted to make some opening remarks.
Yes, and thank you. Good afternoon. I echo the mayor's sentiments and share in his grief for the loss of Walter Wallace. As I shared with the family last night, I extend my deepest condolences to Mr. Wallace's family, friends, neighbors, and community members, and we're all praying for each of you during this difficult time. As I mentioned in my statement last night, I have directed the officer-involved shooting investigation unit to begin its investigation. There are many questions that demand answers. Residents have my assurance that those questions will be fully addressed by the investigation. While at the scene last night, the anger and sadness of the community was not lost upon me. Everyone involved, including the officers, will forever be impacted by this tragedy. I plan to join the mayor in meeting with members of the community and members of Mr. Wallace's family to hear their concerns. I will also be participating in a community meeting this evening to hear residents' feedback. And we plan to work with local organizations and the administration to host several other meetings in the coming days. We are also evaluating what other important information will be made public as the investigation unfolds, as well as our timeline for doing so. First, we'll be completing a threat assessment and determining if and when we can release the officers' names. We know that the public deserves this information. As a matter of department policy, we plan to release it as long as it does not put the officer's safety at risk. We're also examining what other evidence can be shared as long as it does not undermine the integrity of the ongoing investigation. In a moment, I'm going to provide an update into the events that transpired yesterday afternoon into this morning. However, it is important that I reiterate a very important distinction. Yesterday, individuals throughout the city came together to peacefully protest. The criminal activity that occurred throughout the city was not a part of these protests, and it did not serve any legitimate purpose. I would like to acknowledge and thank our officers as well as our community partners for their commitment to their communities as well as the restoration of order. At this point, we are able to present the following updates. We, at approximately last night, originally starting at Malcolm X Park as a peaceful protest, as I said, incidents of civil unrest began to spread throughout surrounding residential neighborhoods and business corridors around the 18th Police District at 55th and Pine, as well as the 52nd Street corridor. As a result, 30 officers were injured. 29 of those have been treated and released, and the majority of these officers suffered various cuts and bruises after being struck by projectiles, mainly bricks, rocks, and other debris. There was one sergeant who is still hospitalized with a broken leg after she was intentionally run over by an individual driving a pickup truck. As I stated, she is currently hospitalized and unfortunately is in stable condition. There was damage to several PPD vehicles, 8 to be exact, one of those 8 were set on fire, and the other vehicles sustained various vandalism and damaged windshields and other windows. There was also one fire department vehicle, a medic unit windshield that was vandalized. Moving on to arrests, there were a total of 91. Arrest numbers from the civil unrest from October 26th going into the morning of October 27th represent all persons actually charged at this time. There were 3 CVNs for failure to disperse. There were 11 assaults on police, 76 arrests for burglary, including 3 with guns. There are still several ongoing investigations not included in the above numbers. So as time progresses, the numbers will be adjusted accordingly. For today and this evening, we anticipate the chance of additional incidents of civil unrest. And as such, we will be taking additional steps to ensure order. We will increase officer presence around the city at key locations. Roving and static officer details that are part of the looting response team will also be deployed to commercial districts and other key locations throughout the city. Police traffic patrol will be in place for any demonstrations that develop. We've also requested mutual aid assistance from surrounding counties and the state to help bolster our own personnel. Thank you for your time today. And with that, I'm open for any questions. I also have Chief Inspector Frank Venor with us if there are any specific questions regarding the officer-involved shooting investigation.
Thank you, Commissioner. And as we indicated, because of limited time and the sheer number of reporters with questions, we ask that you limit your questions to no more than 2. Let's start by going back to Victor Fiorello of Philadelphia Magazine.
Good afternoon, Commissioner Outlive. 2 quick questions for you. First, you mentioned the number of burglaries. Can I assume you're referring to commercial burglaries?
Yes.
Second question, can you commit to release the full body cam footage in the next 72 hours, as many jurisdictions around the country have done after incidents like this? And if not, why not?
So as I stated before, I acknowledge the importance of getting as much information out as possible in the shortest amount of time as possible. We are currently reviewing everything that we have right now to ensure what we can release and by when we can do that. I can commit to releasing information, or actually commit to communicating what information will be released within the next 48 to 72 hours. Whether or not that body-worn camera footage will be a part of that, I don't know at this point in the day. But again, I am committed to being as transparent as possible.
So in 48 hours, you'll be able to tell us if and when you're releasing the body cam footage?
I will be able to.
Thank you.
I don't have a concrete answer for you right now.
Thank you.
Okay, thank you, Victor. And I completely neglected to mention that we are also joined by Commerce Director Sylvie Gaillard Howard if there are questions related to the impact on the business community. Let's go now to Mitch Blocker of NBC 10.
Good afternoon, Commissioner. Police radio indicates that police were familiar with Locust Street and potentially Mr. Wallace. I'm curious, how many times had police been there? Why had they been there previously? What exactly did you know about Mr. Wallace yesterday when you were there?
Go ahead.
It's okay. I mentioned earlier that there are several questions that need to be answered, and that the question you just asked is something that we're considering, including what the officers knew at the time that they responded, what was put out by radio, and again, you know, how any previous contact with Mr. Wallace factored into what happened yesterday. Chief Venor, is there anything else you want to say on that?
Good afternoon. I'm not sure if you could hear me.
Yes, we got you. Go ahead.
What I did want to say in reference to that is we're under the guidelines of specific rules in the Commonwealth of Pennsylvania about when we can talk to the officers with discharge. So until we're able to interview them, it's part of the active case. But we don't know, as the commissioner said, what they knew going into this, and all the other evidence. We're in the process of reviewing video, interviews with eyewitnesses, as well as any other physical evidence that we recovered at the scene.
Thank you.
And Inspector, for those reporters who haven't worked with you before, if you could give us your full name and spelling.
Sure. I'm Chief Inspector Frank Vanore, V-A-N-O-R-E.
Mr. Mayor, you said that you've seen the video. What questions did it raise for you?
I really don't want to get ahead of the police investigation at this point. There were just issues, you know, maybe look twice, but we have more to say on that as we get through the investigation and can release more. I don't want to jeopardize any evidence by just, seeing someone shot is a very upsetting thing to do.
Do you believe that it's possible to investigate this case in a bubble in terms of, you know, the social climate, the very public video of Mr. Wallace's death? How do you think that impacts the investigation?
I think that we need to follow the rules as Chief Inspector Venor talked about relative to the Commonwealth and when we can do certain things. And I also trust Commissioner Outlaw to release the information when it's appropriate to release it.
And if I can chime in on that question, I don't think we are investigating this in a bubble. Obviously, this chat just happened last night. A lot of us didn't leave here until 6 o'clock this morning, and some of us a little bit later. All of these are continuing events, and it's continuing to unfold. As we continue to put our evidence together, whether it's witness statements, involved officer statements, we'll have more information over time. So it is not our intent by any means to be tight-lipped or closed-mouthed about what we do know and when, but we have to be very prudent in ensuring that we respect officers' due process, but also ensure that we don't put the cart before the horse and misspeak and then have to come out later and retract anything that we said because evidence proves something different. So please don't mistake us being intentionally cautious about what we're saying as an effort to withhold information. Again, there is a process in place, and we are bound by certain laws to ensure that the rights of the involved officers are respected while balancing the needs of community, which is why we're meeting with community members and we'll be hosting listening sessions to make ourselves open and available to the public.
All right, thank you, Mitch. Let's go now to Kristen Johansson of KYW.
Hi there, Commissioner. One question is that we've had questions around whether or not this was.
Put it up on Latico. Thank you.
Sorry. Okay, can you hear me? That this was also a domestic disturbance call. Just based on police protocol, we also understand the police officers did not have tasers. Is it typical standard protocol for armed police officers, you could say, to go to domestic disturbance calls? And also, why don't all police officers have tasers?
So these are very good questions. And these are, we all know, well, I guess we don't know, every police officer is not issued a taser at this time. When we went back during this last budget cycle, we requested additional funding so we could continue to outfit our officers with tasers. Some time ago, we deployed tasers along with training. And it was made very clear upon my arrival here that we needed to ensure that everyone, and I mean specific CIT training, it was made clear to me upon my arrival here that everyone needs to have a taser or an ECW, an electronic control weapon, assigned to them, and not have that in tandem with other training provided because it's a separate tool on our tool belt. With that said, these officers had not been deployed tasers, as is the case with many other officers here in the department, and we are continuing to roll out the program as it relates to that. So with that said, yes, it's common for officers to respond to domestic disturbance or any type of call with a gun because it's one of the tools that we carry on our tool belt.
And my second question is just with the de-escalation training, has the mayor, maybe the mayor can answer, have you guys been through that de-escalation training? And is there any insight to trying to overhaul that or maybe look at it from a different angle because this seems to be a situation where it involved a de-escalation?
Yeah, so I will say this, de-escalation training has evolved over the years. I've been in contact as recently as this morning with the Police Executive Research Forum, who rolls out ICAT training. What it stands for eludes me at this time. But at the core of ICAT, again, is not only communications, but it's a critical decision-making model that a lot of departments have transitioned to, and incorporating that into their training, whether it's classroom-based or scenario-based training. I brought it with me and introduced it in my previous role as a chief of police, and it's something that I'm looking into bringing here. So it doesn't mean that we haven't had de-escalation training, but I think as the times change and the type of interactions that we're seeing and the types of calls that we're required to respond to in today's climate, we have to adapt our training along with that, and we will be doing that.
Okay, thank you, Kristen. And let's go now to Martin Pratt of Philly YBN.
Commissioner, it's been reported that the call that was received was a mental health call. Is that correct?
I can't confirm that. Either way, again, we're still backtracking to find out what the officers knew and what was dispatched to the officers at the time that they arrived on scene.
Second question, if someone's experiencing or family members are experiencing family members who are having a mental health issue, what would you suggest the call to 911 contain so that that does not happen?
You know, we ask for, and then there's training components to this, right? So we have asked of the community and what they share and relate to the dispatcher, but we also have to take a look back and see what our dispatchers are asking when folks call. Because when folks call, they may be in crisis or they're experiencing a critical incident and they might not be able to spout out that information. So we have to rethink the types of questions that we ask as well. But to answer your question, you know, I think it's important to just give a full history in layperson speak, what's going on, if there are any weapons involved, if there's a history of the involved person trying to hurt themselves or others, layout of the house. Typically, we like for folks to come outside of the residence or the facility if possible. But again, as much detail as possible. If typically they've been violent in the past, or they haven't been violent in the past ever, but today they are. As much information that we have to help us determine our response while we're en route there is extremely helpful. And we, on our end, again, you know, I think we released that at the end of September. During the day, because it's a pilot program, we now have a behavioral health specialist in our radio room, but only working limited hours. This person was not working at the time this call came out, but this person will assist us. And as this program grows, this person will assist us with triaging calls to determine the most appropriate response, whether or not a police response is most important, or maybe even a co-response with other providers are appropriate. But these are certainly things that we're paying attention to now.
So there's nobody mobile that goes out with?
Not through the police department, no.
Okay, thank you.
All right, thank you, Martin. Let's go to Laura McChrystal of the Inquirer.
Hi there. My first question for the police commissioner, had either of the officers who fired at Walter Wallace ever responded to a call for service at his house before, whether it be that same day yesterday or a previous day?
I don't know if those officers have. I'm not prepared to answer that right now.
Okay. And my second question, we have heard National Guard members saying that they are being called up or deployed in some way in the city. I am a bit unclear on whether that might be for an election-related response or for protests related to yesterday's shooting. Is there anything you can tell us on National Guard movement in the city?
Yeah, the mayor can chime in if need be. But like I said, we have put out a request for mutual aid. And when we called for National Guard in the past, the request was to assist us with security of critical infrastructures, and also among the commercial corridors what we'd seen historically meaning in the last few months, where there had been looting and or rioting. So we are exploring all of our options at this time to do everything that we can to ensure that all of our PPD resources are focused on what's in front of us, whether it's the actual civil unrest or even, again, the crime that continues to occur throughout the city, the shootings and the homicides. So we can focus on calls for service and directly dealing with community, and then allowing for mutual aid resources, again, to be a highly visible presence in these areas, understanding that we cannot be in all places at one time.
And it's my understanding that the conversations with the governor about the National Guard have been based mostly in the election. This incident is a tragic incident that happened yesterday. So those conversations were ongoing relative to the election and the potential fallout from that.
And I think we need to be realistic in that, you know, just given their proximity in time, that there may be some bleeding together, just given the timeline as far as how close we are to Election Day and the days after.
Okay, thank you.
Thank you, Laura. Let's go to Jack Tomzik of Metro.
Hello. Yes, this is for Commissioner Outlaw. You know, there was a video release, and there's been a lot of speculation on that, and about the distance between the officers and Walter Wallace. You probably can't speak specifically to this instance, but what is the distance where someone poses immediate threat if they're not armed with a gun?
It depends. And I want to be very clear in that, you know, the law does not allow us to utilize hindsight, but it really is about what the officer, the involved officer, perceived, experienced, what they were thinking at the time they made the decision to use force. And then any subsequent investigation looks at whether or not, you know, looks at totality of circumstances, but also determines whether or not the force used was proportionate and was reasonable and necessary.
Okay. And is there any information you can provide about how many shots were fired or how many bullet wounds that Mr. Wallace suffered?
Chief Van you want to address that?
Yeah, we know each officer fired approximately 7 rounds, but that's all we know. We don't know how many hit the individual or not. That's all being part of the active investigation. But we processed that many rounds at the scene, and we're still reviewing all the evidence.
Okay, thanks.
Thank you, Jack. Let's go now to Mark Morales of CNN. Mark, you'll have to unmute yourself, please.
Hi, everybody. Just unmuted. Can you guys hear me?
Yep, go ahead.
Hi there. So I wanted to know specifics about the incident as it happened. Approximately what was that distance that Mr. Wallace was from the police? What type of knife did he have? And at what point did he actually, excuse me one second. I'm sorry about that. And at any point did he actually lunge at the officers, or was it that he was ignoring commands?
Chief.
Yeah, like I said, the details of the investigation at this time are being gathered by the Officer Involved Shooting Investigative Unit, along with the Special Investigations Unit of the District Attorney's Office. And we're going to present all that evidence to them. As far as the distance and how that's measured by our crime scene unit, I don't have the answers to exactly the location where he was and they were at that exact moment in time. All of them details, like the Commissioner said, this happened less than 24 hours ago, so are still being put together, and we're going to present them to the DA so that they can make the best decisions as the case moves forward.
Mark, did you have anything else?
Yeah, I just wanted to get a little bit more clarification as to, you know, anything you could say as to what prompted the officers to open fire. Was there did Mr. Wallace say anything? Were there any commands that he didn't listen to? Like, what was it that exactly made them pull the trigger?
I know that information would be helpful, but having not even interviewed the officers yet, we're in no position to be able to answer that question. And anything at this point would be short-sighted and speculatory.
All right, thank you, Mark. Let's go now to Jeff Cole of Fox 29.
Yeah, question to start with Commissioner Outlaw. Commissioner Outlaw, was there a supervisor sent along with what appear to be 2 young officers without tasers when they came to this call? And is that protocol?
I think it's a good question. We do know that a supervisor arrived on scene shortly thereafter. But again, I do not know timeline-wise whether or not a supervisor either self-initiated and was en route or was dispatched because of that.
Is it required for a supervisor to go when there's a call for a man with a weapon? I think this did include some sort of warning that this man had a weapon. Was the supervisor supposed to be along with him?
I do not believe, and again, do not quote me on this, I do not believe that there is a directive codified in writing that it's a requirement for a supervisor to respond, because we get so many calls like that. However, moving forward, if this is something that does need to be codified and strengthened in our directives, it will be. And making sure, again, that a supervisor is not only en route, but a supervisor is available with additional alternatives to alternative response and for coordination of the scene upon arrival.
Last question, Commissioner. It does appear that the man's mother is urging officers not to shoot him. not to shoot it. Are officers asked to take that into account if they're hearing that from a family member or someone in the scene who may know him?
You know, I will say this: we're all human beings, right? And again, when we train, we're talking about totality of the circumstance. That could very well be present. It could be family members or others pleading. You know, I don't want to Monday morning quarterback, because it ultimately all rests upon what the officers experienced at the time that they made the decision to shoot. Different officers, you know, handle scenarios different, right? They might have approached it differently. It doesn't necessarily mean that because of that, what the officers did were improper, but, you know, levels of experience and perspective, you know, lends to how we respond.
Thank you.
All right, thank you, Jeff Cole. Let's go to Ryan Briggs of WHYY Plan Philly.
Thanks. Can you guys hear me?
You got it. Go ahead.
Commissioner, just speaking generally, I wanted to get a better sense, you know, on a given night in a district like this, how many crisis intervention team officers or officers who were trained in that, you know, type of procedure, how many would be on call, and does the department have an issue providing enough crisis intervention officers, you know, just on a day-to-day basis? Does anything like that figure in here?
It does figure in. I don't have the answer for you. We'll have to circle back with you on that to get the exact number, but it absolutely figures in, because again, when we're talking about tools in the tool belt, we want to make sure that, you know, if it's by division or a certain region of the city, if we know that we have a higher level of certain types of calls, we want to make sure that how we deploy the resources that we have available in that respective area aligns with that. So obviously, this is something that we will be considering. The DA's office, when they do their investigation, they're looking at it from a criminal perspective to determine if any laws were broken. But in our administrative investigation, we're not only looking at the shooting itself, but we're looking at what led up to the shooting and the incidents around that, up to and including any risk management issues, if there are any policy changes that need to be made, or any training points or areas of training that need immediate attention. So it's far more comprehensive, and the question that you just asked is a part of that evaluation as well.
Does the department's 911 dispatch have the technology or ability to even flag a call that might have a behavioral health component, or direct particular 911 calls to, say, a crisis intervention team?
Yes.
It does have the ability to do that.
You know, I think it goes back to the original question of, you know, the type of information that we get, and are we asking questions to get us the answers that we need as it relates to that. If we get a call about a person with a weapon and no further details are attached with that, we go into it thinking that it's a person with a weapon. And oftentimes when we're dispatched to calls, we don't have the full picture until we get there. So it goes back to the original point about asking probing questions and getting as much info on the front end as we can. If in the event we don't have a lot of details, that's where CIT training or other alternatives to how we communicate come into play that allow us to slow the situation down, if possible, to get additional information there and be more thoughtful about our responses.
And what's the status of the behavioral health program that the department announced last month, I believe? Is that proceeding? Is there any change, you know, or reconsideration given, you know, what happened here, may have happened here in terms of moving along that process?
So we are in talks with the city. We, at this time, do not have a behavioral health program. There are other, through other city entities, behavioral health resources through behavioral health. And we are currently evaluating how we can bring our programs together so we can figure out, hey, do we do a co-responder model or do we not respond at all? You know, all of these things have been underway, but really got some momentum in the last several months. And we're working with the city to determine just really the types of calls that we should be responding to, and if we do, how.
All right, thank you, Ryan. Let's go now to Claudia Lauer of the Associated Press.
Hey, thank you for taking questions. Earlier when you said a number of officers don't have tasers, is there any information or numbers that you can share with how many officers or what percentage of officers do or do not have them?
Yeah, Claudia, I'll have to get back to you with that number. I'll have our folks circle back with the exact information.
Okay, and then, you know, I know in the last couple of months, there have been a lot of changes, reforms that have been put in place in terms of use of force. In an ideal, and again, I know you can't talk about the specifics of this situation until the investigation is over, but in an ideal situation, what would have been the steps that should have been taken before use of force?
So again, I'm not going to Monday morning quarterback what happened here. And I know it's very easy by me saying, here's what woulda, coulda, shoulda done, could easily be attributed to last night. And I don't want to do that. But again, we will be looking at what happened, what led up to force when any force is used. What led up to the use of force, how much information did we have when the force was used? Was it proportionate to what the officers were perceiving or experiencing at that time? At what point was the force ceased or de-escalated once the threat was either declining or neutralized or no longer present, I should say? What are the other factors there? What are there other community members involved? What's the terrain? What's the environment like? Are you in an open area? Are you inside of a residence? Are you in a small room? There are a lot of factors there, including of the perceived threat. Does that perceived threat have the ability, the intent, the means, and the opportunity to do harm to the officers or others? So again, there's a lot of factors that are taken into account in a very short period of time. And that's what these assessments or these investigations will reveal in the long run. Hopefully in the short term, I would say, not the long run.
All right, thank you, Claudia. Let's go now to Alicia Reed of CBS 3.
Hi, this is for Mayor Kenney. With the number of pharmacies and ATMs that were robbed overnight, and also the stores boarding up today and closing early in an abundance of caution because a lot of them feel there's going to be more of the same tonight. Can you speak to these crimes of opportunity and how that will affect the city in the long term?
Well, we were hoping that we won't have any repeat of what we've seen last night, and we're taking every precaution that we can to be staffed and police manned to avoid that situation that happened last night. We've been through a very difficult time. We recognize that the end of May, beginning of June was extremely difficult. And I will also say that looting is not protest, and vandalism is not protest. So these are not peaceful protesters. There were a lot of peaceful protesters out there last night, and perhaps over the next week or two. But vandalism and looting is not an acceptable form of First Amendment expression. And we will continue to staff and man our business strips, our strip malls, and our downtown and the stores in the neighborhood to the best of our ability, and make sure that we avoid this again.
And Acting Commerce Director Sylvie Gaillard Howard is with us. So I don't know if you had any thoughts you wanted to add on that.
Sure. Yeah. I mean, I think that we have not been asking businesses to close, although we do know that some businesses have gotten in touch with us and told us that they're choosing to do so voluntarily, which is totally up to them. We are certainly, we understand businesses are very anxious right now. They already were anxious about the elections prior to this week and the incident that took place. So we are encouraging to be prepared. To have anything like flower pots or any kind of movable furniture, be ready to take that in and have that really easily accessible to move or not have it outside if possible.
Thanks. Alicia, did you have another question or are you good?
No, that was it. Thank you so much.
Thank you. Let's go now to Emily Cordero of Univision. And Emily, Armando is still with us, I believe, and if you need translation.
Yes, hi, thank you for having us. Yeah, going back to the events that led up to the shooting death of Mr. Wallace, can you guys tell us who made that mental health call to 911 and what was exactly said? Was Mr. Wallace exhibiting some type of erratic behavior? Was he waving this weapon in front of family members or neighbors? Can we get a quick sense of what happened before with that 911 call?
Chief?
We're going to start with Armando.
Yes.
Oh,
Emily, ¿quieres que tu pregunta sea traducida para tu audiencia de habla hispana?
Sí, ¿quién fue que llamó al 911 para reportar este incidente en la ciudad de Filadelfia? El señor Mr. Wallace estaba con un cuchillo en las afueras de su residencia de vecinos. ¿Qué fue lo que ocurrió en esta llamada? ¿Quién llamó?
The question is who called 911 and whether Mr. Wallace was wielding a knife outside of his home. And earlier she said, was he making threats or exhibiting erratic behavior?
That's all I could tell you very generally, because this is what I have in a summary. The details to this are being reviewed as part of the investigation. Is we've received a radio call for a person screaming and that person was armed with a knife. Who made that call and exactly how many of those calls that we've received, I don't have the details to that yet. And I said that's going to be reviewed. All those calls are recorded. We could review them by listening to them. We also will get a warrant and figure out who the subscriber was so we could formally interview them. And all that's still in process. So we did receive a radio call, but that's all I have in general summary of what the officers had arriving there.
Solamente puedo proporcionarte un resumen muy general de los detalles. Sabemos que se hizo una llamada telefónica sobre una persona que estaba gritando y que portaba un cuchillo. ¿Quién hizo la llamada? ¿Cuántas veces se llamó? Realmente no lo sabemos en este momento. Esto es algo que se va a revisar y se está revisando en cuanto a las grabaciones existentes a las cuales estamos escuchando. También vamos a pedir una orden para poder ver esto en mayor detalle y entrevistar a la persona, y esto está en proceso. Compartiremos mayor información según la tengamos.
Muchas gracias. Thank you.
all right. Thank you, Emily. Just to note that we only have a few more minutes left, and so we're going to end questioning with those whose hands are currently raised. Let's go next to Yaima Crespo of Telemundo.
Sí, mi pregunta es para Outlaw. ¿Qué tipo de entrenamiento se le está dando a la policía de Filadelfia en casos de que una persona que se reporte con algún tipo de problema mental, pues se asista de una mejor manera y no se llegue a los disparos?
The question is for Commissioner Outlaw. What type of training is the police department in Philadelphia receiving for dealing with cases where there's reports of persons exhibiting mental health conditions so that this has better outcomes?
Thank you for the question. So I think, again, Chief Venor shared the details that came out of the call. Again, like I said, we tend to find out more once we get there. But as it relates to someone in crisis or experiencing, it could be crisis or someone under the influence, or they may have mental disabilities. And sometimes it's very difficult to discern between that upon our arrival. We provide crisis intervention training to our officers to ensure that there is a focus not only on de-escalation, but slowing things down if situations allow for that, to slow things down, to create time and distance, to establish lines of communication, whether it's with those who are trusted, who are already on scene. And again, in an effort to contain and create distance and space, to find out as much as we can in an effort to communicate and find alternative resolutions. This is ongoing training that we do roll out, but as I mentioned before, there's always room. We are a learning organization. There is always room to enhance or improve our critical decision-making models and any training associated with that. Because again, this training is not only helpful for dealing with someone in crisis, but there's a strong focus and emphasis on interpersonal skills to slow situations down when possible. With that said, we may, having all these amazing tools available to us, we may find ourselves in situations where it escalates rather quickly and we don't have the necessary time to go through all of those steps.
Bien, quiero básicamente agradecerte por la pregunta. Como ya lo dijo el Chief Lenore, Y nosotros tenemos en estos momentos el estudio de esta llamada para poder exactamente qué es lo que sucedió, que vamos a averiguarlo luego. Pero cuando alguien está en crisis o se encuentra bajo la influencia de sustancias o tiene incapacidades de salud mental, es difícil discernir en esos momentos qué es lo que se está sucediendo. Y damos capacitación en cuanto a intervención en situaciones de crisis para deescalar la tensión y para poder bajarle la velocidad a las cosas y manejarlas de una mejor manera, establecer una distancia en tiempo y en espacio. También tratamos de encontrar personas en quien se pueda confiar, que estén ya presentes en la escena de los incidentes para contener esto, para poner, como dije, mayor tiempo y distancia. Pero tratamos también de encontrar alternativas para resolver los casos de una forma continua. Hay capacitación que comprende, mejor dicho, el aprendizaje, la mejora y el avance de las situaciones en el momento de la toma de decisiones, que es algo que es útil en situaciones de crisis. Pero nuevamente, el desarrollo de las capacidades interpersonales como una herramienta para tratar de escalar una situación se tiene que aplicar rápidamente. Nosotros vamos a seguir aprendiendo de ello, incorporando esto a la capacitación que se les da a los oficiales de policía.
Emma, are you all set?
Thank you.
Very good. All right, we're going to go next to Kennedy Rose. After that, Dan Patrick and Michaela Winberg, and then we'll wrap. So Kennedy Rose of the Philadelphia Business Journal, you're up.
Hi, my first question is for Sylvie from the Commerce Department. I was wondering, in addition to the recommendations of asking businesses to bring large flower pots or outdoor furniture indoors, is the city doing anything else to help businesses affected or that could be affected by looters or damage?
Yeah, thanks, Kendi. So at this point, we are in touch with all of our partners that have boots on the ground, like our CDCs, our business improvement districts, to assess the damage. And I will say there is damage certainly beyond 52nd Street, at least I know of at least 8, 9 other corridors that have been impacted, if not more. So, at this point, we're really just advising that precautions be taken, and we'll sort of see what we can do moving forward. But at this point, we're really just in direct communication with the businesses about those precautions.
Okay, thanks very much. And my second question is.
Kennedy, I apologize. I accidentally muted you there. If you could unmute yourself and then.
No worries. My second question was for Commissioner Outlaw. I was wondering which commercial corridors will have increased patrols, and I was wondering how does PPD determine that?
So we can push something out a little bit later with additional details. I will tell you the commercial corridors that we will be focusing on are the ones where we had some issues at the end of May, early June. Specifically for tonight, there will be a lot of concentration on the areas where we know there are planned events and there's potential for pop-up protests, which is back in the West Philadelphia area around that 52nd corridor and around the 18th Police District. But again, given that we know, I keep saying historically, but it was just a few months ago, that there was some unrest, there were vandalisms scattered throughout the city, including Center City, we will be diligent in ensuring that there are resources in those areas that were victimized before.
Okay, thanks very much.
Thank you, Kennedy. Let's go to Dan Patrick of 6ABC.
Hi, my first question is for the Commissioner. Regarding the people that were arrested, do you have demographics on them? We're hearing word that they may not be from that neighborhood. A lot of leaders in that neighborhood are telling us they are doers from somewhere else, as if they use this opportunity to go cause civil unrest. Do you guys see anything in terms of that?
I'm sorry, I didn't mean to cut you off. We'll have to circle back with you on that as far as their residences or where they're from. But that was our general sense, speaking anecdotally. We tend to not like to speak anecdotally. But I will tell you that the crowd that were out there on the scene, the residents from that neighborhood, those who witnessed the incident, those were the folks that I interacted with while there. Those were not the same people that we later interacted with later on once I left that scene. It was a completely different group of folks and, quite frankly, demographics that we saw there. And I heard from community some of the same frustrations expressed as well.
Okay. And my other question is for Mayor Kenney. Chad Wolf, the acting secretary of DHS, has said he's offered support for the city to drastically stop this again. What are your thoughts and response to that?
I'm not aware of any support. I did read something that the president was going to monitor, quote unquote, the situation. We've been dealing with Governor Wolf for additional assets, and we always deal with our federal partners in law enforcement at the FBI, at ATF, and the like, in the marshal's office. So we have ongoing relationships with them. They help us process evidence. They help us with many different things when it comes to intelligence and the like. So we have a great relationship. Our commissioner and command staff have a great relationship with the local federal authorities, and we'll continue to do that. And President, welcome to monitor anything he likes, and we'll continue to deal with Governor Wolf for additional assets if we need them.
All right, thank you, Mr. And finally today, Michaela Winberg of Billy Penn.
Hey, everyone. Quick question for Commissioner Outlaw. Does the department have a civil unrest plan? And if it does, what time last night was it put into action to respond to protests or looting?
Yes, so this completely caught us off guard in the sense that, one, no one can predict that there is an officer-involved shooting. And two, once we arrived there, we saw that there would be civil unrest because it was beginning to unfold upon our arrival there. Once that happened, we immediately began to put resources in place, ensuring that there was a request made to open the EOC where I am now, extending shifts, canceling days off, pressing the button for mutual aid, having conversation with other stakeholders in city administration to ensure that all of perspectives were being met. And that's where we are now. So the answer is yes, there is a plan. It just so happens, again, we're also planning for any pre, during, and post unrest that may occur as it relates to elections. So a lot of key people are already available and at the table. And that's where we are now. So yes, there are plans, and we continue to build as things unfold. But I want to be very clear in that what happened yesterday afternoon, well into last night and into the morning, none of which was planned.
Sure. So do you recall what time it was that the plan was put into action?
We immediately began to mobilize our resources upon our arrival to the scene of the officer-involved shooting. Seeing that there were a lot of angry residents there. There were a lot of voices that needed to be heard. And generally our first step, aside from containing the area, would be to call our civil affairs unit. And that's what happened almost immediately. And we went from there. So early afternoon.
Okay, thank you.
Or early evening, I should say. You're welcome.
Sure, thanks.
Thank you. Thank you, Commissioner Outlaw and others. We will advise if future avails are planned on this topic. Otherwise, please send any questions or requests for comment to press@phila.gov. Thanks.